doctor's orders. Looks like he ordered a tracheostomy for the patient. And it looks like his previous attempt that it was done on him, he tolerated well. All right, so I'm gonna gather all my supplies and equipment. I'm gonna get the drape, I'm gonna get my tray kit, I'm gonna get the saline. Now I'm gonna go introduce myself to the patient. Then I'm gonna get some hand hygiene. Hello, my name is Oscar. Today I'll be your student nurse. Can I please have your name and date of birth? Thank you. I'm gonna close the curtains and give patient privacy. Now, what I'm going to do is I'm going to assess your heart rate, your rhythm, and your oxygen levels, and your lung sounds real quick. Okay, so what it looks like is that I do notice some gurgling in your lungs. I also did notice that your O2 is low, and I'm gonna let you know before we begin this procedure, which is a tracheostomy, which is getting a tube going to the trach port and just suction all the secretions out, and this makes it a lot easier for you to breathe. I also do have a trach hour available just in case you start releasing secretions through your mouth, and this would be easier for you to breathe. I will let you know that there is a chance that you will cough, but there is also a chance that you will feel discomfort throughout the procedure. If you do, just please raise your hand and we'll stop the procedure. And okay, so now what I'm going to do is I'm going to set up a patient to a semi-phallus position, and I'm going to raise the bedroll for me and start putting the drape onto the patient. Now I'm going to just organize myself here, get the cup here. All right, remove this, put this here, put some saline here, and I'm also going to let you know, I'm going to turn the suctioner for 80 to 120, depending on what it is. I'm also going to give you hyperactive oxygen 100%, as we're doing in betweens if it's needed. Okay, now I'm just going to remove the packaging. Now I'm going to look inside. All right, I'm going to flip this. Flip this over. Perfect. I'm gonna grab this. There you go. Now I'm just going to remove the tube here. Perfect. Now I'm going to connect the tube in using my left non-dominant hand. Okay, now that I got some saline in there, I want to check in here. Let's lubricated as well. Okay, and now what I'm going to do is I'm going to remove the mask and I'm going to suction. Okay, now I'm going to go down. All right, cough. gonna suction it back in. There you go. Now I'm gonna put you back on oxygen for a minute. Then I'm gonna go again here, get it to set in here again. Okay, perfect. All right, now a minute has passed. Now I'm going to do one last time, okay? Take that out. And I'm gonna go, make sure, and I'm gonna go down there real. There you go. And perfect. Now I'm gonna go back, remove it all. And now I'm gonna keep the oxygen first. Keep back on 202. All right, now I'm done. Take those out. Throw this in the trash. Now I'm gonna wash my hands. Okay, now I'm gonna reassess your situation. See how it's going right now with your vitals, your lung sounds. Okay, so your O2 did increase, and I did see improvement in your lung sounds, less gurgling around. Now I'm going to also lower the bed, put the rails back, make sure everything's secure, make sure there's a call button if you need us, and keep the oxygen where it's at. And I'm also going to document before I go. I'm going to document that the patient did tolerate the procedure well. Notice that his lung sounds did improve and his O2 level did increase. And I'm also let you know, like the trach hour is still there just in case it does happen, so it's available for you to remove the secretions if it's coming out of your mouth. If you have any more questions for us, I'll be outside. Some hand hygiene, and the call button's right there. Thank you.